ER doctor on how to handle choking, part 4. This is the last in my series of reviewing the Lifevac and the Dechoker to pull it all together to show you what to actually do if somebody is choking. Now, I know this is a lot to take in and remember, so please take a CPR and first aid course so you can get hands-on experience for what to do, and download my choking quick guide so you always have the information you need right at your fingertips. Comment choking below and we'll send you the link for that. So of course, as an emergency room doctor, I care about choking, but also a quick story about how this is personal. When my daughter was 14 months old, she was sitting in her high chair and she started choking. And I could see her starting to panic because she couldn't breathe. Adrenaline kicked in, I swooped in, I grabbed her out of her high chair in one move, got her onto my forearm, and I started doing back blows. After a few back blows, I was able to see it and pull it out of her mouth. She started crying. It was the most beautiful sound I'd ever heard, was to hear my daughter able to start crying again. I then started crying and shaking at that point. And it was a terrifying moment, and it was a moment that I was so glad that I knew what to do. And I wanted to make sure that every parent knows what to do in those terrifying situations that I hope they'll never be in, but that they know how to handle it if they have to. Now, if someone is choking, here are some of the signs that you need to intervene. 1, if they're silent. They're really not making noise when they cough, they cry, or they breathe, or they're making high-pitched sounds like when they breathe. Number 2, of course, if they're turning blue. Or number 3, if they look panicked, if they're tripoding, meaning they're leaning forward, or they're flaring their nose muscles, or they're using their neck or their abdominal muscles. That means they're working really hard, and they're going to need you to intervene. Here's what to do in that scenario, and have someone call 911 if the person is not getting any better. So here's how to take care of an infant, meaning a child less than 1 year old who is choking. Of course, if your infant's starting to choke, have someone call 911 at the same time you're taking these steps to remove the choking object. In infants, you alternate between back blows and chest thrusts. You do not do abdominal thrusts, what you may know of as the Heimlich, like we do in adults and older children. So just back blows and chest thrusts in infants. So if your infant is choking, you can sit, kneel, or stand, but from my experience, you're going to do whatever's fastest. So start out with them laying on your forearm, then take your other hand and put your forearm across their chest and put their jaw in between your thumb and your forefinger. Now flip them over onto this arm. And again, they can be on your arm, or you can sit down like this and have them resting on your thigh, which can help. Most importantly is that you have them on your forearm with their head below their chest and their back. You want to make gravity work for you, not against you. Now you're going to take the heel of this hand, and just between their shoulder blades, you're going to hit hard 5 times. And you're going to go in and up toward their head. 1, 2, 3, 4, 5. This part might feel crazy, but you have to hit hard. I mean, I get it. They're your babies, right? But many parents don't do this part well enough. In fact, I once had a doctor tell me, moms never hit hard enough, because you want to give 5 quick and very solid back blows. Now, after you've done the back blows, you're going to look in their mouth and see if you can see the object. Do not do a blind finger sweep, as that could potentially push the object further into their throat. But look and see. If you can see the object or the food there, then pull it out right now. If not, and if they're still choking, now you're going to switch to chest thrusts. So again, have them on your arm, and again, you can be standing for this, or you can sit down, either way, and either way have their head below the rest of their body. So for chest thrust, you're going to take 2 fingers and you're going to find the center of their chest just below the nipple line. And you're going to push 5 times. You actually want to go in about 1.5 inches on their chest. Again, it will feel like a lot, but you have to create enough positive pressure and force to try to get that object out. 1, 2, 3, 4, 5. Now check again in their mouth to see if you can see and remove the object. Of course, if you can't, by this point, you're going to be having somebody call 911, and then continue back and forth doing 5 back blows, check the mouth, 5 chest thrusts until 911 arrives or until you get the object out of their mouth. Now, would you use one of these devices on a choking infant? The Dechoker site actually says only for children age 1 and above. The Lifevac says for children 22 pounds and above. So it definitely wouldn't be the first thing that I reach for. If you choose to use it on a slightly older infant, then the only situation where I would use it would be after you have done 2 to 3 cycles of back blows and chest thrusts, still can't get the object out, then maybe doing 1 or 2 maximum attempts using these devices before you switch back to those other maneuvers. More than 1 or 2 attempts, remember, you can cause swelling and blood pooling in the back of the throat, and that's going to make it harder to get the object out and waste precious time. Now, if the person choking is above 1 year old, whether that's a child or an adult, we'll do slightly different maneuvers. Here you'll do the abdominal thrusts, which you may have learned as the Heimlich. You'll do back blows, and then the option of adding in chest thrusts. Here's how you do them. Of course, at any point in this series, remember to call 911. So first you'll do 5 abdominal thrusts. You'll have them stand up straight and you'll get behind them. Make a fist with your thumb against their belly, just above their belly button. Cover it with your other hand and pull in and up. You'll do that 5 times quickly. After you do that, you're going to look in their throat. If you can see the object, pull it out. If you can't see it, do not do a blind finger sweep. Switch to back blows. Now to do a back blow, place one arm across their chest and bend them over so their body is parallel to the ground, their head maybe even a little bit lower, and you're going to take the heel of your hand and you're going to hit them 5 times firmly between their shoulder blades. Again, after you're done with that, look in their mouth. If you can see the object, pull it out. By this point, you would already have had someone call 911, and here's what to continue to do. You can go back to abdominal thrusts and just cycle through those 2 things, or you can add in chest thrust, which is to take the same hand position that you have for the abdominal thrust, just have it over their chest, and again, push in and up 5 quick times. You're going to cycle through those 3 things: 5 abdominal thrusts, 5 back blows, 5 chest thrusts, and keep cycling them until you're able to relieve the choking object. Now, you don't have to buy either of these. In fact, I don't strongly endorse either one. Check out my videos 2 and 3 to help you decide if you do want to get them. If you do choose to get one, then here is the only scenario in which I would use them. And that is after doing 2 to 3 really solid rounds of standard choking care, of abdominal thrusts and back blows. If the person is still choking, grab your device, give it a really good solid 1 to 2 attempts with a good seal and good suction, check their mouth to see if you've pulled out the object, and then if they're still choking, go back to your standard choking care. In the worst case, if the person becomes unresponsive, do not use either of these devices. You're going to start CPR. That's beneficial because 1, it's getting oxygen to their brain, and secondly, the positive pressure from CPR can also help to remove the object. I know this topic is scary, and you never, ever, ever, ever want to think about it. Please, please, please take a course, like a live one through the American Heart Association or the American Red Cross, or the virtual course until help arrives through a collaboration with the American Red Cross and the American College of Emergency Physicians. Also, check out my choking quick guide so that you have all the information that you learned in those courses right at your fingertips. Comment choking below and I'll make sure you get it. Please let me know what other questions I can answer.